I saw UK Healthcare up there on the screen with the epic 10 stars.
Don't believe them.
Well, they were up there. Your folks were cheering. I watched that thing this morning.
No.
Their general session with the CEO there. So.
Yeah, they've done a pretty good job.
Yep.
Good
You know how us
afternoon.
finance people are. We always find something to pick at.
Absolutely. The finance folks are, right?
Yeah.
All right. Let's see. I know I saw
Good afternoon. This is Sarah with the Department of Medicaid. How's everybody doing this afternoon?
We're good. How are you?
I'm doing
Good.
well. Thank you for asking. A quick request. The commissioner was going to try to hop on with us. She may have a conflict. If not, would you mind moving item B, old business, up a little bit so Justin can address and then hop on to another urgent meeting?
Yes, absolutely. We
Thank
can do
you.
that. We can do that. So we can call a meeting to order. I believe we have a quorum. I know we've got. I don't see Lori yet, but I know we've got Elaine and Teresa, and I know we've had Danny has retired, and I know KHA is looking for a replacement there. So we've got a quorum. Minutes from last meeting. Anybody have any changes or additions? If not, can I have a motion to approve?
Motion. Oh, sorry.
Teresa, can I have you turn your camera on while we vote, please?
So I'm traveling down the road.
Just while we vote, I apologize. It's for the open meeting laws. Or if you're going to be at a point where you might be able to stop shortly, we can do that in a moment. I'm sorry.
I'm trying. Give me 1 second.
Oh, and the commissioner is joining, so that gives us a second. Thank you. I'm so sorry.
There she is. All right, all in favor?
Aye.
Okay, thank you. All right, and old business, we want to move the B, sepsis 2 versus sepsis 3 up to the top.
And the commissioner did join us.
Okay. Welcome, Commissioner.
Hi, how are you? Good to be here.
Good to see you. How are you?
Good. I just wanted to pop in really quick. We're on the sepsis now. Sorry, I was a couple minutes late. Talking about the sepsis. You know, we have received a lot of feedback. We've received some comments. We've had a lot of conversations about this, and we see and now that it's going to be a lot more complicated than just moving from sepsis 2 to sepsis 3 overnight. So what we have decided is we believe that we need to move towards sepsis 3. However, we're not going to do that until January of 2025. One of the reasons for that is definitely due to discussions with the Kentucky Hospital Association and some of their concerns related to movement and their quality measures tied to the hospital reimbursement improvement program. And we think that before we do move to sepsis 3, maybe, the beginning of 2024, we need to have some bigger conversations about exactly what that looks like when we move to sepsis 3. I think there's a little bit more discussion that needs to be had maybe between the medical directors and this body here, the technical advisory committee, so we move forward in a way that is appropriate with sepsis 3. I think there's a little bit more discussion that needs to be had maybe around some of the clinicals related to sepsis 3. We do believe that we want to move towards sepsis 3, but think it needs to take a little bit more time to get there. So just wanted to fill you all in on that and give an update on the decision that was made and see if you have any questions that I can assist you with.
I don't right now. I appreciate you listening to us and I appreciate the delay so that we can we can have discussions and do it in a methodical way so everybody's on the same page.
Yes, that's exactly our thoughts too. And I again think it's going to be just a little bit more involved from moving from sepsis 2 to sepsis 3. And we want to make sure that we have, systems in place and want to make sure that everybody is on the same page with the requirements going forward. But again, it'll be January 1st of 2025. So I think something that we need to keep on the radar for the hospital TAC so that we can start having those conversations, maybe, mid 2024 so that we're all ready we're ready for that January 1st start date in 2025.
That sounds like a plan to me. We can definitely put that on the agenda and have, like I said, we're always available for any discussions and meetings that you guys want to have, and we appreciate you listening to us and appreciate the update. Do the TAC members have any questions, Elaine? Teresa?
Nothing for me. Just thank you, Commissioner. We appreciate it.
Yeah, thank you all. We really appreciate everything you're doing for our Medicaid members. I think most of you know that I always say that the Medicaid program was created for our members, but we can't take care of our members without our providers. And we really appreciate everything that you all do and this partnership, and just look forward to future meetings where I can spend a little bit more time with you all in the meetings.
Thank you, Commissioner.
Yes.
I appreciate it. We appreciate you.
Thank you.
Thank you.
I'll be on for just a little bit. Turn my camera off, but I'll be here just to kind of listen a little bit and be here if you have any additional questions for me.
Okay, thank you.
Thank you.
Okay. All right, so that takes care of B. A, I'd like to table, I'm still waiting for some input from some folks from some other hospitals on the policy, and then I will bring that back next meeting. New business patient re-enrollment delays. So for the folks at DMS, we've gotten some reports through the Hospital Association and some hospitals that we're seeing delays with a re-enrollment process. We've had multiple hospitals report like 1 to 2 hour time frames on the phone per patient to work a re-enrollment. I know there's a lot of volume going on, and I know the resources are probably limited, but we wanted to kind of report what we're seeing and get any feedback that you guys may have for us.
Hi, this is Lisa. I'm not sure who else is on the phone from our policy folks, and particularly with enrollment. If you have, I think one of my suggestions would be if you have someone in your facility that let's say that they've had a service that day and they're trying to get their eligibility redetermined, and if they're having a really hard time, I would recommend going the presumptive eligibility route for the hospitals, and you could get that individual that presumptive eligibility that day and receive payment if they had received a service in your facility, and that might help them give them a little bit of time to get their actual renewal back in place.
Okay. I didn't know if anybody had. I don't know how long it's taken for someone to get re-enrolled. I know we did have feedback that if there's an application in, they are not
Ineligible for presumptive eligibility.
Disenrolling them, right? Is that the right term? If there's an application that's in and hasn't been processed yet.
Yeah, we are, if there's an application in, and it hasn't been processed, I don't believe that we are disenrolling those individuals yet. I do know that our eligibility workers are seeing about a 40% increase in their workload. If you do have somebody that has an application pending, it seems like that's an emergency. I'm not, if you can contact us, we'll see what we can do. But we do know that the processing times are taking a little bit longer due to the unwinding process from the public health emergency.
Sure. Okay. All right. Good. Good suggestion on the presumptive, on the PE for that day of service. Appreciate that. Elaine or Teresa, anything else?
No, that covers it for me, Russ.
Okay.
Me as well.
Okay, thank you. And And then general discussion, other items. We did have one question that came up. Does the 2022 HRIP quality distribution, is there a timetable on that yet? I know they're gathering the data and looking at the and analyzing all that. Do we have a time frame on that yet? Do you know?
I believe we're shooting for sometime in November, October, November.
Okay. Is there anything that you need from us?
Not at this time, I don't, no.
Okay. All right. Okay. Any other items from the TAC members? Okay. No recommendations today. I will represent and give an update at the MAC meeting. The next meeting is Halloween, October 31st, 2023. We'll do it by Zoom again. And Commissioner Lee, thank you for joining us, and thank you for the update on the sepsis. And thanks to the DMS folks for today, short meeting today. I appreciate everybody, and we'll stand adjourned.
Thank you, everybody. Have a wonderful afternoon.
Thank you. Have a great
Bye.
day.